I think so, because it's already been 8:05, right?
Do you want us to welcome everyone or?
Yeah, we have an intro slide with both of your names. So maybe
Okay.
we'll run through the title and then get right to you.
The only thing I'd like to ask is at the very end of the session, we'll do a screenshot so we can take everyone's pictures. So,
maybe
Yeah, sure.
you can do it.
or should we do that now?
Yeah, because
do it now
afterwards, once people start sharing the screen, it'll be hard to get everybody on the.
I also have select, so I'm heading out a few minutes early.
Okay.
So if everyone can turn your videos on just for a minute, because we're going to take a screenshot.
Yes, please. All right, on the count of 3, if everyone can smile. Ready? 1, 2, 3. Perfect. Thank you all.
All right, thank you.
Okay. Okay.
Okay, let me share it again.
All right.
So who's gonna be the moderator?
I got it.
All right.
For the beginning. Okay. All right. Well, welcome everybody. Thank you so much on the US side for joining us this early this morning. And thank you so much, as usual, to our Taiwanese colleagues for planning this with us, for meeting with us after class hours. So today we would like to present Into the Multi-Health Universe, Global Health Conversations. Our group decided this we would play on the, I think it's the Avengers a little bit.
The Spider-Man.
Yeah, that one. So yeah. So just to give a little bit of an intro on why Emily and I are doing this, this past summer, we really had the amazing opportunity to work in Kaohsiung, Taiwan. So that's the second largest city in Taiwan. I'm Taiwanese, so this had a huge, this was very personally amazing for me to go back. Emily has worked previously in Taiwan, but this offered a completely new experience. And the reason for that is that we worked at I-Shou Hospital. And so I-Shou Hospital and the affiliated university I-Shou has 2 MD programs. One is the I-Shou University School of Medicine, and that is for Taiwanese students, so Taiwanese residents, and I-Shou University School of Medicine for international students, where they actually have offered scholarships to students from around the world. And so while going to Taiwan, we actually had the opportunity to meet so many lovely colleagues from actually around the world, a lot of Caribbean countries who you'll see today, some of whom you'll see today. And we found that the hospital was totally bilingual. We were able to train in both English and, if we felt like it, in Chinese, but that's definitely not a prerequisite. And so, yeah, we wanted to share that experience with you and just kind of dive into a bit of a high-level conversation on how our different health systems differ. So we brought on a couple panelists today to kind of talk about their perspectives and start the idea of a conversation series that could continue on for the rest of the year. So now we would like to introduce, I'll ask Dr. Menezes to say hi first, but she is our program director from the US side.
Hello, everyone. My name is Lynette Menezes. I'm the AVP for International for US of Health, which consists of all the 4 colleges that includes medicine, nursing, pharmacy, and public health, and also the Assistant Dean for International for the College of Medicine. And I'm also one of the directors for the Scholarly Concentration in International Medicine. So I'm very excited in all my roles to have all of you here this morning to be able to talk to each other a little bit more about how the different healthcare systems work. When we started this conversation series, it was during the pandemic, because we felt that this was a great way that our students from different parts of the world, because we couldn't send students abroad and we couldn't have students come in, because we have very robust student exchange programs with many universities across the world. And this helped us keep in touch with some of those universities and help our students. And so when Grace and Emily decided, and I worked with Dr. Wong to get them over to Taiwan, we decided why not start with a conversation series to kind of maintain those relationships that you build, and hopefully when you all graduate, you will continue to keep in touch and build probably then, more research collaborations, clinical collaborations, and there's a whole world out there that you could do so many different things in the field of international medicine. And with that, I want to warmly welcome each of you, and I hope some of you can come and rotate with us here in the College of Medicine and our hospital, Tampa General Hospital. And I hope to see you all soon, both in Taiwan and here. With that, I'm going to have my very good colleague, Dr. Joseph Wong, to introduce from the Taiwan side.
All right. So, I'm so excited. I'm so excited. I can't stop smiling because finally we get this meeting going, because this is our original goal, to have a connection between two sides of students. So I just want to share with you a little bit story. So actually the story was started from 2017 when USF's College of Medicine and IDA Hospital, I-Shou University signed MOUs. So and then I still have a lab at USF, in the Department of OBGYN. So I kind of flew back and forth between IDA Hospital and USF every 2 months. I stayed 2 months and then fly back and forth. All right, so in the past 6 years, USF faculty members had chances to visit Taiwan, and IDA Hospital also donated money to USF Foundation for perinatal research. So the collaboration in perinatal research has never ceased during that period of time. Unfortunately, in May this year, the MOU between IDA Hospital and USF College of Medicine was renewed, and USF selected two outstanding students, Emily and Grace, to visit Taiwan in the summer. So I'm glad that to see the connection between USF and I-Shou students has been made during their stay. And thanks to the efforts of students from both sides, I'm hoping that the meeting between I-Shou and USF students will become an annual routine. Then the collaboration and the connection of students from both sides will last forever. So currently, I'm working with Dr. Menezes and TGH to have I-Shou students visit Tampa. So I also like to see more USF students to visit Taiwan in the near future. So good news to share with you is that Professor Lockwood, your dean and vice president, will visit Taiwan in November 2024. So we are kind of arranging that visit right now. So I strongly believe that tighter relationship between USF and IDA Hospital, I-Shou, will be established soon. So finally, my best wishes to everyone participating in this collaboration. Thank you.
Thanks, Dr. Hong. Okay, and now I want to introduce our amazing panelists. The first amazing panelist being me, I guess. But I'll just ask all of my panelists to state their name and what country they're from. So I'm Grace Lee, and I am from the United States.
And then I'm Emily Law, and I'm from the United States as well.
And I'm Rose Shi. I'm from Taiwan.
My name is Mike, and I'm from St. Lucia.
And I'm from Taiwan.
And Geraldo is running a tiny bit late. He'll be here soon, but he is from Belize.
And I'm Vivian. I'm from Taiwan too.
And I'm Tanya, and I'm from St. Lucia.
Great, thank you guys. Yeah, so the agenda for today is that we're going to really broadly and quickly talk about three major health topics. The first being health systems, the second health disparities, and the third complementary alternative medicine, which has a huge place in Taiwan. And we will have our panelists moderate these sessions. I will be monitoring the chat. So if you have any questions, feel free to write it in the chat and we'll answer them at the end of each panel and at the end of this presentation. I need to head out early for select, so we'll ask you to just kind of raise your hand afterwards if I'm not here. But for now, just put the questions in the chat and we will answer them. So with that, I'll welcome Vivian and Tanya to talk about health systems.
Hello, everyone. I'm Vivian, and I'm going to talk about health system in Taiwan today. And next page, please. And this is what I searched online about national healthcare insurance of Taiwan. It's a CNN news says that NHI is one of the 10 things that Taiwan does better than any place else. But is the system really so great? I will talk about it now. Next page. Next. First, let's talk about how does this national healthcare system work. Inside this triangle is my NHI card, IC card. As long as you are in the insurance, you'll get your IC card, and no matter where you went for healthcare in Taiwan, doctors can get all your medical information from this little card. Since most people in Taiwan had paid premium for NHI to National Health Insurance Administration, when we get sick, we can go straight to appropriate medical institution for help, and we just have to pay not the total fee, but only co-payment for medical service. After giving service, medical institute will reimburse to NHIA asking for money they have spent for a patient, and NHIA will give you money ideally. But it is common that NHIA says no to some service and doctor will have to pay for those on their own. And this triangle is a perfect situation, but it doesn't work so perfect in the real world, and I'll talk about it later. First, from the point of patient often think that they have to pay for they have paid for insurance, so they are the boss. And healthcare is so convenient in Taiwan, so lots of patients prefer doctor shopping, and they will keep shopping until they find their most satisfied doctors. This phenomenon will lead to medical resources wasting too much. So this is one of the problem of this system. And second page, and from the point of doctors, just since NHI provides certain amount of money to all the medical service in Taiwan, the more doctors do, the less money will the doctor earn. And it was a dilemma because if the doctor wants to give their patient the best service, the doctor may have to sacrifice their own salary. But if the doctor don't get their salary which equal to their work, it may end up that patient didn't get well care, and doctor are not happy too. So it might start a bad cycle that patient and doctor are not happy and don't do the good work. Second page. And from government's point, government needs to set the standard on self-pay treatment and health insurance treatment. But it may make some people think that national healthcare insurance is unfair because although everyone pays same money for the insurance, but it's always be some people go to seek doctor more often, which makes using the insurance more often than other people. So this is another problem for the government should solve. And this is a case that I have met and I want to share about. This patient is a type 2 DM male, and he has already took the maximum dosage of metformin, and he had reached the standard to switch to use GLP-1, the better treatment for type 2 DM. And if we were in hospital, one of the medical institution, once patient reach the standard to use GLP-1, they can just use GLP-1 as a better treatment. But this patient wants to stay at the local clinic to follow up his situation because he thinks that it was more convenience for him. But the local clinic still give the patient metformin only. But the clinic suggests patient to buy GLP-1 on self-pay. So this is a quite strange case that we can think about why these things happen. Yeah. And these are some problem. There are some problem in this insurance situation. Yeah. Thank you.
Okay, hello again, everyone. I'm Tanya, and I will be speaking to the health system in St. Lucia. Okay, so in St. Lucia, we have both public and private health sector, and there's a very clear differentiation between the two. Generally, the healthcare in St. Lucia is financed by the government, and contributions and user fees from what we have called the National Insurance Corporation. This corporation was put together many years ago in St. Lucia in an attempt to provide financial and social security for the citizens, and it plays a very big role in our healthcare, especially the public sector. Right now, St. Lucia, unlike Taiwan, does not really have a solid national health insurance plan. So universal health coverage is not something that's very good in St. Lucia. However, in 2021, the government initiated a health insurance plan, and in the first phase, they said that they would primarily focus on chronic diseases like hypertension, cancer. So they would cater to these patients initially. And so they're trying to formulate a plan where they have citizens pay a premium instead of using the reimbursement routes. So whenever you need care, you would be able to access it. Next, please. All right, so in our public sector, we have the Ministry of Health and Wellness. That's the logo right there on the screen. And they're the ones who oversee most of the healthcare in St. Lucia. And we have several primary care clinics in the different communities. We have 2 secondary level hospitals, and we also have a mental wellness hospital. So that's our only tertiary care facility in St. Lucia. And yes, moving on to the private sector. With the private sector, it's very expensive. And so the services tend to be fee for service, or if you're someone who has a private health insurance, you'd be covered by the reimbursement of that insurance. And one of the hospitals in St. Lucia is a private one, and we have a few clinics that also follow this system. All right, so we have 3 questions that will be answered by our panelists based on health systems. The first one says, how can health systems harness technological advancements for more efficient and effective care delivery?
Well, I'm going to share the Taiwan's part for technology advancements. So, as Vivian previously said, our health identities were stored in the IC card. So, for big data and analytics, health system can use big data lytics to identify trends and patterns from the patient's data. And these informations can be used for like personalized treatment plans. So in Taiwan, we can have access to collect all the data of the patient. And due to the different conditions, we can analyze the results about different health issues and know what is the problem of the patient or the society. So our national health system really makes the collecting informations easier.
Thank you, Ronnie. Number 2, what strategies can be implemented to address shortages and burnout among healthcare professionals?
Yeah, so I'll take this one from the US side. Largely in the past few years, definitely exacerbated by COVID, we've been seeing a very high rate of burnout in the United States. Some of the ways that we've combated that is by having quite a large influx of nurse practitioners, nurse anesthetists, PAs, kind of doing more, taking on some of the quote unquote simpler cases that go on in the US to kind of reduce the workload of physicians and leaving physicians to work on the more complex cases. I will say that one of the caveats to that is that we heard about how in Taiwan there's a very high health seeking behavior. Because the doctor is so accessible, they go to the doctor more often. That's not the case in the US, where people typically wait till they're very, very ill before they seek care. And so a lot of the time you come in and you already are that complex case. Some other models that we've established is recently I've been learning more about the 7-on, 7-off hospitalist care model. So just having a hospitalist who is trained in these acute care situations kind of take over some of the complex acute care cases. And then also mental health. So I was looking at the American Medical Association, and there's an entire page listing a bunch of resources for mental health. I'm sure many other organizations have something like that. It's a conversation that's coming to the forefront a little bit more. I think there's more for us to do, but at least we're we're now understanding that physicians also need to take care of themselves too.
Thank you, Grace. And our last question for this section is, how can health systems effectively control rising healthcare costs while maintaining the quality of care?
Okay, so I'll answer this question. And I know in most countries, this seems like the opposite thing to do, not actually control healthcare costs. But I think the main thing here is like investing a lot in public health sector, primarily focus on preventive care in the populations, because I think the more people who are sick and the more people who need care, it contributes to the more resources that are needed in medicine. And that's why healthcare costs keep increasing every year, year after year. And that automatically brings down the quality of care because more physicians have to see more patients, and the more patients they have, the less time they have with each patient. So maybe sometimes some things go missed because they don't spend as much time with each patient as may be needed, because they feel a lot of pressure to see all the patients that they need to see because so many people are sick. So I think if you invest in public health and preventive medicine and preventive care, then people are more educated about the things that cause them to be sick, especially in our daily lives, like food and nutrition. I think it can help less people develop chronic illnesses, which is like the main burden on most of our healthcare systems. So if people have less chronic disease, then there's less reason to go to the doctors, and doctors also see less patients. I mean, in some cases, that may not necessarily seem like a good thing, but referring to Grace's question as question 2, that also helps prevent them from having burnout in healthcare professionals because they're not overwhelmed by the patient system and people with chronic illnesses. So I think public health sector with primary focus on preventive care medicine is a very important way to care costs and also have a good quality of care for people who actually need it.
Thank you. That'll be all for health systems.
Can I add something? Because I really enjoyed some of the important points that most of you raised. And I just wanted to add particularly to what Michael was saying, because in the United States, we spend less on prevention. We spend a very, very small percentage of our healthcare costs is on prevention. And that's why we probably have some of the lowest lifespans among developed societies. And I think the challenge is you spend so much of money in your last year of life or your last few years of life that there's never enough money to spend on prevention. And it's what that makes all the difference, right? If you prevent early, you are not going to have many of those issues and many of those diseases that come with age. And so I think you raised a very important point, and I just wanted to add to that. All of you have brought in some very, very important things, and your national health insurance is something we don't have, right? We don't have a universal healthcare system. So we struggle here to provide healthcare to many of our underserved patients. And so we have underserved clinics to help underserved patients, and people volunteer their time. So those are some of the challenges we face. I just wanted to add to what you all were talking. Great work.
Actually, can I say something? So actually, I think that the health insurance in Taiwan, people are still debating whether we want to use money for treatment or prevention or both. People are still debating that whether we should spend money on prevention, because actually there's another thing, because in general the medical cost in Taiwan is much cheaper than that in the US. So there are so many physical checkup, and then for the program, which kind of offers you for physical checkup, you can pick whatever test you want to test. So so there are so many different packages. Then but those physical checkup is basically out of your own pocket. It's not paid by insurance. But that's still cheap relatively, compared to that in US. For example, if you want to do like a 640 CAT scan, for your lung, you would only have to kind of spend like a $200, $200 US dollars for that. As you can compare, the expense in the US. Even those out of your pockets, they're kind of relatively cheap. But that's probably better for prevention. So that's the reason why some people argue that we should spend money more on treatment instead of just prevention.
Thank you, Dr. Wong.
Thank you. I think we'll move on now to topic 2, health disparities.
Okay, and I will address some of the health disparities that we face in St. Lucia, and they will relate to the US also, because they're similarly related. But I put up this graphic because it just shows the definitions between equality, equity, and justice. So as we can see, like equality, we assume that everyone benefits from the same support, but we all know that everyone actually does not need the same support. Everyone has different causes that we need to address. And then for equity, everyone just gets the support that they need. So as compared to the first one, whoever needs more than the other will get it, and whoever doesn't need it doesn't have to require getting any support. And then for justice, it's just that we remove the barriers that actually require people to want or need support. So I think in our healthcare system and in most of our healthcare policies, a lot of these things are caused by barriers that actually are currently in place, whether it's to hinder a certain group or other groups from acquiring certain accesses. Then it's one of the main reasons why we have so many health disparities actually all over the world. But I think the main cause of this is because we put up these barriers, whether it's systematically or not. We put up barriers that prevent people from getting actually access that they need. So without them, you can see everyone has access to the things that they need at appropriate times. And I'll just talk about the main health disparities that they have in St. Lucia. And the four main ones will be socioeconomic status, education, geographic, and cultural beliefs. And just to explain that a little bit, for socioeconomic status, a lot of people in St. Lucia actually live below the poverty line. So like as far as like income goes, there's not really high income levels in a lot of the population in St. Lucia. Those who do actually have high income levels, it's probably less than 1%. So they have access to the healthcare system more easily than others. And in St. Lucia, it's like the US where you go to the doctor, you expect to pay a lot of money, even just to see the doctor. And even if people who actually go, who are not able to maybe afford like extensive treatment, if they go to the doctor, they maybe can't afford to even pay for the medication based on what they have. And education is the second thing. I think it's probably closely in tie with socioeconomic status, because a lot of people in St. Lucia are very uneducated about how their lifestyle behaviors can affect their health in general. And I think the limitations that we put on education for people in the lower class, actually it hampers them further in healthcare system because they have different beliefs and different understanding of what health is in general. And geographic location will speak to just the access. A lot of people who live in rural areas, there's not a lot of access to health facilities, because the main health facilities in St. Lucia are actually in the big cities that we have. So these people, it's too much to go to a health center or to a hospital to get treatment. So they usually try to deal with it at home. And the fourth one will be cultural beliefs. Now, this is a very sensitive topic because a lot of people, older people, don't have a lot of faith in modern medicine, and they try to pass those beliefs down to the other generations because they believe that, you know, someone is always out to get them. You know, there's always a bigger picture, and they can always solve these things on their own using their traditional medicines and traditional beliefs. So it's just something, it's a very thin line we have to walk, but, you know, it's just convincing, or how to convince them that modern medicine is actually good for them. And I'll explain that in the next slide. And just some strategies, I just named one for each just to like cut down on the time. But for socioeconomic status, we should create a system similar to Taiwan. So Taiwan has a national health insurance. I think St. Lucia could benefit from that greatly, because a lot of people who actually have chronic illnesses or have diseases that need urgent care are in the lower socioeconomic status, directly related to the education level. So they are not aware of all these lifestyle changes and things that they need to do in order to stay healthy. And to address the education aspect of it, I think doing mobile clinics and doing awareness campaigns monthly, they actually started doing that a lot recently, where they'll go out into communities and educate people or do campaigns with incentives, obviously, to get people to understand how their lifestyles and the things that they do can contribute directly to their health. Because in St. Lucia, we have a lot of unhealthy habits that people think are good, but it's not. For example, like being skinny is not ideal in the eyes of traditional St. Lucian lifestyle. And for geographic location, just invest in like sustainable infrastructure. So maybe even if it's just a health center where people can attend maybe once a month for free, or a certain age can go for free. I think if we have infrastructure that's accessible to most of the population, then we can also like reduce the health disparities. And then for cultural beliefs, just restoring faith in modern medicine. So if you tell people or you show people that, you know, if you do this, or you take this medication, or you take this treatment, your chances of being healthy or having a better quality of life, or life expectancy is greater as compared to you thinking maybe what your grandparents or great grandparents tried will work better. Then I think we can actually change the dynamic of what people think is better for them in the long run as compared to what they believe is passed down to them through traditional, just cultural beliefs.
Okay, so in my part, I'm going to talk about the Taiwan's health disparities, and as Mike has said, there's a lot of similarities, including the economical status and also geographic regions and a level of education part. So first, I'm going to talk about the income factor. One of the significant contributors to health disparities in Taiwan, and I believe is happening also among other countries, is the social economic status. So people with lower income often faces challenges accessing to healthcare services. And like in Taiwan's current condition, I have heard that the wards in the hospitals is often not enough. So there's also different kinds of wards for the national health system will pay some of the money for some of the wards, but some may have to pay by the patients themselves. So like people with higher incomes or like they can afford like better wards room, and often these better ward rooms will be empty and available. So as a result, with people who have poor incomes will have poor health outcomes and a higher prevalence for chronic conditions, and also kind of reduce their life expectancy. And I'll go the factors in a clockwise direction. So next, I'm going to talk about the geographic regions. So for Taiwan, because Taiwan is like an island, and we also have a lot of the small islands besides us. And also we have a lot of mountains living with some aboriginals. So in these rural and remote areas, they often have limited healthcare infrastructures, like they have a shortage of medical facilities and healthcare professionals. And this leads to that they have not enough access to the healthcare services and also like the specialized care. So I have heard one of my friends that when he lived in an island that was a little bit far from Taiwan, and when he was little, he had a fever, and it's quite serious. So he can have a proper access of healthcare in the island there. So he had to take a helicopter to the main island of Taiwan. So I think that residents of these areas often experience delays in seeking medical care, and due to the distance they need to travel. And also they may often have delayed diagnosis and treatment. So these are the causes of the poor health outcomes for the geographic region. And for another interesting part in Taiwan is that, because for gender part is women tend to live longer than men, and this difference is attributed to some various factors, including like men's occupations have higher rates of injuries, or they may have a higher rate of heart disease or certain types of cancer. But on the other hand, that women may often experience higher rates of mental health issues. And this may be by society expectations and traditional women roles. Like in Taiwan societies, it's often said that women will have to go back to their families and take care of their children. So for women in society, they may want to work as well as they take care of the family. So this kind of stress is responsible for the health disparity part. And for the level of education, I know that it's also happened a lot in other countries, is that people may not have a basic know of the like certain health decisions about what their health conditions are, and even which clinic they are going to assess to according to their health conditions is not that possible for people with not that level of education. And the last part is the ethnicity, and I think is quite a common disparity in Taiwan, because we have a group of different kind of races, and cultural and language differences often create barriers to healthcare access. Like in the Aboriginal communities, they often trust people with their same community, and they don't trust the doctors. But I think that I'll say the strategies the government do in the next slide. Okay, so for the first about the economic status part, I think that our national health insurance system did a very well job, because the main goal is to let people pay the less money, but also get the best care. And so for our national health insurance system, the people with the higher income have to pay more for the health insurance. And also our government does a lot of like plans for like negotiating with the medicine factories to like negotiate in with the price of the medicine and to make people who needs these medicine to pay less money, and also the hospital can provide them with better care. Yeah. And so the geographic region factor for our government, there are two ways. The first one is to have financial incentives for hospital workers to when they serve in these rural and remote areas, they may have a double salary, or there's double salaries. And for the second factor is the telehealth and telemedicine services. So I think due to the COVID pandemic, the telehealth and telemedicine services have upgraded a lot in Taiwan, and these services allow patients in remote areas have direct consult with the healthcare providers, and it really improves a lot. And for the gender factor, as I said on the previous slide, is that a woman have like a more cause of mental health. And I think there's quite a cool fact that the government actually launched a plan this year that 15 to 30-year-old people who needs like mental health consults have 3 times of free medical consult services. And I think that recently Taiwan's talking about mental health has been quite like viral, and it's something that our society is improving. And for the level of education part, there's a lot of health promotion programs, not to mention about not only the hospitals, but also like medical students does a lot of health promotion programs. And for the ethnicity part, there's a lot of cultural training for the healthcare providers in the hospital too. Yeah, so I think Taiwan did a lot of efforts and strategies on reducing the health disparities in Taiwan. So now I'm going to ask the 3 open-ended questions about the health disparities, and starting from like the easiest one. The first question is, what can medical students do to ensure the equitable access of care?
I'm Rose, and I'm going to answer the first question. As medical students are relatively young generation in medical field, what we can do is to come up with ideas that those in charge are unable to think of. For example, put modern technology into practice, like what Ronnie has mentioned before, virtual clinic, teleclinic or something, or distance ultrasound. Or we can work with people in other majors or regions. Together, we can brainstorm and come up with various ideas, just as this panel discussion. People with different backgrounds may share with each other how our country deal with their problems. Learn from others and utilize in our country can come up with a new solution. Most importantly, we should discuss with doctors that are standing at the first line of healthcare, who knows the core problem of present healthcare, and may check if our ideas can be put into practice. But we must also acknowledge that there will always be some variations in the supply of health. Nonetheless, efforts ought to be made to ensure that all areas are acceptably serviced by the range and quality of healthcare. Thank you.
Okay, thank you, Rose, for the very excellent answer. The second question is, can someone share examples of successful initiatives or programs either locally or globally that had effectively reduced health disparities?
Okay. Hi, everyone. I'm Geraldo, and I'll be answering this question. I will choose to give a local example from my home country, which is Belize. And basically, Belize is widely known within the PAHO region, which is a Pan American Health Organization. So it falls under Latin America and the Caribbean. And our maternal and child health program is widely recognized in the area and the region for ensuring the equitable access of vaccines for the infants and children. So what Belize kind of did, and I think some of our colleagues already mentioned and touched on the certain topics, like for example, in the setting of mobile clinics, and actually on health professionals going into the communities and actually looking for the candidates for the vaccines. So in ensuring a wider network or catchment on and ensuring that we understand the community as a whole and that we understand the dynamics of how the community works. And then entering the community, they were able to understand and appreciate more a more holistic approach to the patients. And I think that is a very good example because it is a small change, but if you notice, it create and ripple down a larger effect. And it increased the trust that the community has in the healthcare professionals so that they can be able to trust the healthcare profession and the system in itself and themselves seeking now the care rather than us going directly into the communities. So now they have the interest of actually going into the clinics and the mobile set of clinics. So that is one example that I had. Thank you.
Thank you, Eduardo, for sharing. Yeah. Oh, okay. So for the third question, how have recent events such as the COVID-19 pandemic highlighted existing health disparities, and what lessons can we draw from these experiences?
Okay, so I'm Emily, and I'm going to answer this from a more U.S. perspective. I think the COVID-19 pandemic really highlighted some social disparities, especially in the healthcare industry when it comes to essential workers and people of minority ethnicities. So essential workers are people that, have to work during pandemics. So you have your people that work in food industry, people that work in service industry, and those industries are typically predominated, I think, by lower socioeconomic status people, which happens to be made up by people of color. And so I think COVID really showed that these people who had to constantly be working maybe had less opportunities to work remotely, and as a result, receive less COVID testing as well as less COVID treatment. And so by the time they are actually receiving treatment, it's often at a more severe COVID level of illness. And so I saw some interesting statistics that actually more than half of patients that were hospitalized and who died from COVID were typically Hispanic and Black. And then even within the Asian population, Asians made up the highest number of cardiovascular cases in those situations. And so I think it just goes to show that there is a lot of disparities across ethnicities, typically due to underlying causes of racism, fear of getting medical treatment, whether that's distrust in the industry, whether that's just bad experiences in their day-to-day life. And so I think as people that want to go into medicine, it's something that we have to really take account of trying to provide the best care to anyone that we see, because it's up to us to kind of encourage people to get treatment, as Geraldo was saying, because that is the best way to take care of someone, is if they are motivated to get that care too.
Yeah, thank you, Grace. I also think that the COVID pandemic actually brought about our society about the public health part. And I think the health disparities part is that, yeah, this session is over. Yeah.
Okay, and now we will move on to our last section, which is complementary alternative medicine. I know we're a tiny bit behind on time, so we'll try to run through this quickly. And if we're a few minutes over, anyone who needs to drop off can, but we'll be here for a few more minutes.
Okay, thank you so much. So now we may be asking, what does complementary and alternative medicine is? So we try to simplify it as much as we can, and we agree that it is a sharing of beliefs values, and knowledges and practices that have been brought on from different generations. And they could be from different countries. So I could be in Taiwan, but I can bring my own traditional and practices from my home country into Taiwan. So it doesn't really mean that it's integrated, but it's shared, okay? And a lot of times, many of even healthcare professionals, some may have strong beliefs that it is against science, or maybe it doesn't have a solid foundation or evidence to be able to prove that it's actually, you know, like if it works. Because as you know, we go with evidence-based. And most importantly, I think one of the best concepts in complement and CAMS, if I can abbreviate it, is that it takes in consideration a holistic version of the human body, which is the mind, the body, and therapy. So it integrates everything into trying to look at everything. Next slide, please.
So why people use CAMS? First of all, prevention is prioritized to any other reasons. After all, stay away from disease is the most important task for everyone in the world. For those who are healthy, CAMS can be used as improvement for their body and mind. For those who are ill, CAMS can be a choice for treatment. Last but not least, CAMS serve as a way for people to find a balance in both outer and inner environment, both body and mind. Next page, thank you.
Good. So now we look at who practices CAMS. And like we said, it is a shared belief. So it could be traditions that are brought from different countries. And majority is not only indigenous communities in itself. Maybe they're the ones that richly practice it in a ritualistic manner. But now it has gained some movement in the modern society. And so you'll hear a lot of people saying holistic this therapy. And so it has gained a lot of movement now. And also, importantly, it has a very big concept in religion. So if you want to understand your patient, you have to be able to know who, okay? Next slide.
Okay, CAMS composed of 4 important elements: mind, spirit, heart, and body. And the core idea of CAMS is to reach holistic health, which is also the ultimate goal as Western medicine we frequently use. Therefore, CAMS is not only an alternative for Western medicine, it is a therapy that can be used together with the mainstream medicine. Okay, next page. So now I'm going to share the CAMS in Taiwan. I'm Rose in Taiwan. I'm going to share the CAMS. Okay, next page. I want to share these 2 different kinds of CAMS. First is Chinese medicine, and second is religious therapy. Next page. For the Chinese medicine, I think many of you have already heard of acupuncture, herbal medicine, and chiropractic, which is known for breaking people's neck. Next page. But I'm going to introduce 2 more, I think it's more interesting therapy in Chinese medicine. First one is cupping therapy, and the second is moxibustion. Next page. Cupping therapy is the therapist will put many cups on the patient's back, and before it put it on the back, it will use the fire to vacuum the cup. When you put on your back, it will make the bruises and make your back have many circles of red things, purple or black. So I didn't put the pictures of the finish doing this one because it looks quite scary. Next one, thank you. Next, thank you. Grace, can you? Oh no, QQ. Okay. I think maybe I can share my. Oh no. Okay, thank you. And the next one, I'm going to share moxibustion, which is Grace said that it's like a sage in America. It's like putting some leaves and burn it on your back. It's like speed up your circulation and can be chase the bad spirits away. Next one. And Chinese medicine to be conclusion, it is based on knowledge, and some are scientific based already, like the herbal medicine or acupuncture, have been gradually acknowledged by WHO. And these knowledge are treasures from ancestors, which Chinese medicine have been used for more than thousands of years. And the core of Chinese medicine is to find balance in both inner and outer environment. Also in Taiwan, we have Chinese medicine department in university, which means Chinese medicine is a type of mainstream in Taiwan. It's already acknowledged for our government and all the people. Next page. Next, I'm going to introduce about the religious therapy. The first one is charm. The yellow one is like a necklace that the people will put on their neck or in their back to find for the spiritual comfort. Yes, like that. When people think putting something that have been the God have protected, it can protect us from the bad spirits. And the red one is the tool that people ask for advice for the God. So if my uncle got a gastric cancer, and doctor said have to accept chemotherapy, and so my uncle will go to in front of the God and say, my dear God, should I accept the chemotherapy? And if the God say no, and people will say, oh, sorry, doctor, it's not good for me. My ancestor said I cannot accept. So like the religious is a very important part in Taiwan. So it's also which makes the doctor headache. And the last one is votive candle. It's like lighting a candle and we'll put next to the God, which can, as long as the candle is burning, it means God is protecting us. Next page. But what is different from Chinese medicine? Religious therapy is just only #believe in God. It is not scientific based. It is not with any knowledge of something. It is just a beliefs in people. Next one. So why alternative medicine is so popular in Taiwan? First of all, it is more nature. Western medicine is always accompanied with plenty of side effects. Some people believe that Chinese medicine is a more natural choice to heal. Second, some people only believe in traditional therapy. Different from Western culture, the scientific-based medicine is a relatively new concept in Taiwan. For my grandparents, Chinese medicine is their only choice when they are little. Therefore, they would rather believe in a traditional one rather than the novel Western science. Third, because it is more mysterious. Western medicine is so precise that it can tell everything about the healing effect, including the percentage to recover, relapse, or even death. On the other side, both Chinese medicine and religious therapy don't explain much about this. Instead, they only show the successful cases, which are seen to be miracles. People searching the last straw to survive may stick to it without hesitations. So they are just waiting for the miracles. Okay, thank you.
Okay, so now I move on into speaking about camps in Belize. So the difference between Belize and Taiwan in itself is that in Taiwan, it is already established, and there's actually a regulation on the use of camps and the use of the respect of it in the pharmaceutical area. However, in Belize, it is different. In Belize, it coexists as a tradition. So it's Belize and tradition. It's not by itself. And it includes two different and popular areas, which are medicinal plants and traditional healing rituals. Belize is very unique because it is a home of a multicultural society. So we're actually like a bridge. So we connect the North America to the rest of Central America. So we are home to a lot of migrating communities. And most popularly, there are two of the communities that are heavily practice CAMs, or that those are the patients where we can encounter them. And these are the Maya descendants who practice any use of traditional herbal plants, and also the Garifuna people who also practice the skills to clear the spirits and cleanse the body. So that's like more spiritual related. So in Belize, particularly, there is a lot of research that is currently in place and ongoing. And one of them famously known is the I-Shou Tropical Research Foundation. And this research was started in 1987. And particularly, it's started by an enthusiast that is very interested in herbals. So she has worked and collaborated with different people in the country. And these are two books in case you are interested in, into pharmaceuticals. Give a look. Next page. Okay, so in Belize, there are three influential people that started the whole CAMS background, and they're famous for their contributions. Particularly on the far left, you can see an old man there, and he's showing a species of roots to the teacher. So his name is Eligio Panti, and he was famously known for being the last shaman of the Maya people in Belize. So he actually is the one we would call a bush doctor, right? So people, instead of going to the doctors, they go to him, right? So he would be even prescribing the herbal medication and giving his own titrating qualities, like he would tell you like how much you need to take of each herbals and how to combine them or when to take them, which is, very in particularly resonates with being a doctor, right? And the second person on the far right is a traditional learner that was passed on from different generations. So her grandmother taught her mother, and her mother taught her, and her name was Miss Hortense. And so she taught a lot of the current midwives in Belize, and actually the OBGYN experts, on different techniques on ensuring a safe delivery in women, particularly in Belize for the remote areas. Delivering your baby in the 80s was very difficult, and the 90s, because getting to the hospital was very, very difficult. So instead of going to the hospital, they would choose to go with Miss Hortense, which would be the one delivering the babies for you, right? And the last person here in the middle, this is actually my grandmother, and her name is Juana Shish, and she's also a herbalist, and her grandmother taught her mother, and her mother taught her, and she started teaching me, but we didn't finish the class. So she also does a lot of herbal medicine. She passed away already 5 years ago, and she left a lot of rich teachings in the particular area of where I am from, right? Which is a different area of my country. And particularly, she's more specialized in infants. So in ailments that the small children would have, like tummy aches, having the flu, or having constipation, they would normally go with her. And she would normally prescribe a herbal remedy and have alleviations of the ailments. Next page, please. So now we move on to the question area, okay? And we have a question number 1, and it asks, is there a space for CAMS within the healthcare system?
I'm going to answer this question. I think there is definitely a space for CAMS within the healthcare system. Take one of the Chinese herbal medicine, for example, and it is also Professor Huang's research. 桂枝茯苓丸 is a Chinese herbal medicine, and that was used to treat abortion. And in Professor Huang's research, it shows that 桂枝茯苓丸 may be helpful to endometriosis. So when some women don't want to have surgery around their uterus, so the better treatment for them can be suggest them to take 桂枝茯苓丸 to maintain the situation and keep following up at OBGYN clinics. So yes, I think Chinese medicine or CAMS can work together, and it might turn out to be the best treatment for patient.
Good. So thank you so much for your response. It's very nice and insightful. We go to question number 2. And how is CAMS looked as in your home country?
Okay, so I'll answer this question from a US perspective. I think in the most recent years, alternative medicine has actually been rising in the United States. I've actually seen how it's been incorporated in a lot of pain management. For example, when I worked at a clinic, whenever we would prescribe opioids, my preceptor would always emphasize that our patients should also look into alternative medicines like acupuncture or potentially some type of massage therapies or yoga, ways to just complement your Western medicine treatment. I think because of how diverse the United States is, we do have a lot of influences that Rose and Geraldo have been talking about, whether it's with herbal medicine, whether it's with acupuncture, things like that. One thing I do want to mention is, in addition to kind of what we have been talking about regarding CAMS, like acupuncture, like herbal remedies, I think arts have also played a role in this in medicine, specifically when it comes to palliative care. I think using art as a way to relieve stress has been becoming more and more popular, and it's also been a way to accompany certain more chronic conditions like Parkinson's, for example. They'll often encourage their patients to maybe enroll in like a dance class so that they can continue moving their body and things like that. So I think this space is definitely growing in the United States.
Thank you so much, Emily. Very nice input from your side. We go to question number 3, and it's very nice. It says, as a medical student, how can you enhance your learning into CAMS that is suitable for your home country?
Okay, so I will be answering this question from the perspective of St. Lucia, but I would just like to say generally, I think as a medical student, if you're trying to enhance your learning into CAMS, then it would involve formal education, practical experience, and also I would say self-study in the field. I think it's also very important to begin by researching and understanding the regulatory and legal framework of CAMS in your specific country, because you don't want to do something that's not really legal or illegal. And so I think that would be a good basis to begin. And then from the perspective of St. Lucia specifically, I'd want to say that I would consider improving my communication skills and my language skills. And by this, I mean, because in St. Lucia, the older folk, the older generation are the ones who are primarily responsible for these types of therapies. And they tend to speak what we call Creole in St. Lucia. It's like Taiwanese in Taiwan. And since we have this French dialect being the primary language, I think for me in St. Lucia, it would be very important to learn these skills so that I would be an effective communicator with the other CAM practitioners and also with patients. And also, I think what would be very important as a med student is to delve into research using scientific methods to have hardcore scientific evidence on how effective CAM can be. And then I think with that, we could advocate for like an integration of CAM into our healthcare system, because it's really not part of the healthcare system like how Chinese medicine is in Taiwan. And so if we do that, then we could involve the policymakers and healthcare institutions, and it would become part of our society. But altogether, I'd say that it's very important for us to stay open-minded and willing to adapt our knowledge. As we could see, that CAM has become something that's very rapidly developing. And so just be very aware of the new information that emerges as it comes to CAMs. So yes, that's my answer.
Yeah. Also, if you want to learn more about CAMS, come to my lab. We are not only doing endometriosis therapy, we also but also doing cancer therapy for ovarian cancer using Chinese herbal medicine.
Thank you much, everyone, for sharing. So we're just going to skip the last thing because we are running over a little bit, but I just wanted to thank everyone so much for coming today. Thank you, all of our friends in Taiwan, for Dr. Huang, for Dr. Menezes, and all of the USF students, and students in Taiwan as well, for attending this. Our contact information is listed here. If you're interested in what we kind of just discussed, where we have discussions from around the world really about any topic in medicine, we're trying to start a small conversation series this upcoming year. We plan to have our first session sometime in December, and we hope to have it maybe 4 times for the rest of the school year. If you're interested, we have a QR code listed right here. You can go ahead, scan it, and then sign up. It just asks for your name and just your school affiliation. This way we know who is interested, and we'll also send a follow-up email with a more in-depth survey. But that is everything from us.
Emily, I think
Yes.
there was one question from Mehdi.
Okay, let me take
because I think we didn't open it up to the other students for questions. So if anybody has any questions, or Mehdi had a question about what is the process of drug approval in your respective country. In the US, we have the FDA, so I think he was curious to know whether you have each of the St. Lucia, and also in Taiwan you have something like an
Yeah, in
FDA.
Taiwan we have a TFDA. We have TFDA, Taiwan FDA.
In Belize.
Yeah.
Geraldo, do you know whether in Belize you all have
Yeah, in Belize currently now, yes, they have implemented. It's not a regulation, but it's still ongoing. So a lot of the research that is still ongoing in terms of like CAMs and possible herbal medications, they are currently being informed that in the future they need to apply for approval of. I believe it's more with patent rather than the actual like an FDA.
Okay.
In St. Lucia, we don't have a formal drug approval agency, I would say, but we use the Pan American Health Organization's approval, which follows FDA guidelines for drugs. So we only use drugs in St. Lucia that are previously been approved by the FDA in the United States.
Okay. Or maybe that, yeah, because the PAHO is part of WHO. So the WHO also has their lists of approved drugs.
Sorry, thank you.
Thank you all so very much. And I hope to see you all soon.
All right.
Thank you, everyone.
Thank you, everyone.
Thank you. Bye-bye.
Thank you. Bye.
Great job.
Thank you.